atherosclerosis is a process whereby plaque builds up in the arteries of people and leads to different diseases. So these include diseases such as myocardial infarction or heart attack, stroke, and what we call peripheral vascular disease, which is the arteries of the legs. And this can cause different symptoms depending on which part of the body the plaque builds up. Atherosclerotic cardiovascular are very important because these are one of the leading causes of death as well as hospitalization in our healthcare system, and thus trends of these diseases have a big impact on the overall system. So what we did is we analyzed the data from ICES over a 20-year time frame, looking at temporal trends in the hospitalization rates for 6 atherosclerotic cardiovascular conditions. We also studied death rates from what we call a circulatory disease, which is basically anything that affects the circulatory system of the whole body, non-circulatory diseases such as cancer, as well as ischemic heart disease and cerebrovascular disease deaths. So we observed approximately 50% improvement in the rates of hospitalization in Ontario for the whole population, and we found the greatest rate of improvement occurred in 50 to 74-year-olds. However, we also observed that among the younger population, those under the age of 50, that the rates for the most part were flat, and in some cases actually increased over this time frame. For example, we observed that the rates of stroke in younger men actually went up, and the rates of heart attacks in younger women under the age of 50 also went up in this time frame, which is a finding of significant concern. We need probably more study to determine exactly why the rates have gone up. I think part of the reason relates to the fact that most of our research efforts as well as preventive efforts have been aimed more at the middle-aged population, and we haven't been as aggressive in terms of doing research in the younger population in terms of understanding a disease in the population as well as determining our optimal risk factor strategies. We also know from other data that the risk factors, for example, smoking in young women has gone up over time. The rates in obesity in both men and women, as well as diabetes in the population, are also increasing. So these could be some of the factors that are causing the findings. People also talked about, for example, younger females being under more stress now as compared to 20 years ago. That may also be a factor that's driving some of the increased heart attack rates we observed. So I think this study is a nice illustration of the power of what we call big data. These are data that cover the entire population that go back many years. So in the study we were able to look at the trends in these diseases over a 20-year time frame for the entire population of Ontario, which is really a very powerful resource that allows us to not only look at the overall population trends, but also the trends in certain demographic subgroups such as men versus women and different age groups. And we can get a lot of very useful insights by just looking at these large databases that can help inform healthcare policy as well as planning and help drive where we need to do future research to understand how to better improve the cardiovascular health of Canadians. I think these results are encouraging in terms of we have made significant advances in terms of decreasing the number of Canadians dying as heart disease as well as being hospitalized over the last 20 years, suggesting that all of the efforts that we've put into heart health promotion as well as investments in terms of new treatments have paid off with this increasing survival rate from these various conditions. On the other hand, although the overall results are good, we do see some concerning trends. For example, the modest improvements, in some cases worsening in the under 50 population is a source of concern, because as this group gets older, they will become the 50 to 75-year-olds of the future, and we may not be seeing the same improvements that we've seen historically in this group if the trends that we observed in this study continue. And so I do think we need to continue our research efforts in this area and particularly focus on those at the younger age spectrum.